So good evening, everyone. Sean Graham, Director of Government Affairs for the Washington State Medical Association. Always enjoy the opportunity to meet with this group, and especially on a day like today, where we've got some fresh news to share with everybody. The legislative session in Olympia just concluded on Sunday, and I'm going to give you all a very brief overview of what happened in Olympia. We'll start with the fact that this was a really exceptional session. And I mean that in a couple of senses. One, we saw some major wins for the physician community, which was great. And two, exceptional in the sense that it was conducted over Zoom, like most aspects of our lives these days. And I will say the legislature pulled it off pretty well. I've talked with colleagues in other states, and it sounds like their experiences have been pretty rocky. Our state had it pretty closely resembled, a regular in-person session. We'll look at the budget side first, and this was something of a moving target. If you rewind to say a year ago or so, even less than that, the state was anticipating that there was going to be severe economic disruption as a result of the pandemic. As time has gone on, the state's budget picture improved considerably. And then in February, the federal government passed the latest stimulus package, which brought more money into the state. The net result of that is that state legislators had a pretty favorable budget picture to work from, and that helped facilitate a couple of big wins on the spending side in terms of Medicaid reimbursement, foundational public health services, and medical education. We'll take the last one first, medical education. We saw continued support for physician residencies, for health professional loan repayment that helps support workforce endeavors for the physician community. Around foundational public health services, we've known for decades that our state's public health system has been chronically underfunded, and anybody who didn't know that before is very aware of it now that we are in the midst of a pandemic. The legislature put $150 million over the next 2 years into foundational public health services. That's going to help respond to the pandemic, as well as broader goals and aims and activities of public health system. And then the last one there, Medicaid reimbursement. This is a increase for primary care services as well as pediatric services and behavioral health services. A grand total of about $140 million of state and federal money that's going into the Medicaid system, the state's Medicaid system over the next 2 years, again, to help shore up primary care rates, pediatric rates, and behavioral health rates, all by about 15%, at least 15%, I should say. We know that there are, the state needs to improve Medicaid reimbursement rates across the board beyond the primary care setting. And that is where we will be turning our attention next, is going back to the legislature saying, great, thanks for this kind of down payment on Medicaid reimbursement. We need to look at specialist services as well. On the tax side, we went into session again, anticipating that the legislature was going to be in a fairly dire budget situation, fearing that there would be talk of increasing the state's B&O tax, perhaps establishing a statewide payroll tax. Unfortunately, those conversations never really materialized. Rather, the legislature ended up establishing a state capital gains tax. I'm glad to talk about that more if folks have questions, but long story short, Washington was one of just a handful of states that did not have a state capital gains tax. Democrats who control the legislature felt that establishing one is important to kind of rebalance the state's revenue structure. We will see, there's already been a challenge that was issued, or a lawsuit that was brought against the capital gains tax today, challenging its constitutionality. So we will see how that plays out. On the policy side, a couple quick ones to take through. Again here, in short, WSMA had a 100% success rate on our priority policy issues this year. Unprecedented during my time at WSMA, so pretty exciting stuff. We successfully defended against all the bills that we were opposed to, including a number of scope of practice expansion proposals. For example, one for the naturopaths, another bill that would have required AR&Ps to be paid on parity with physicians. And then on the positive side of the ledger, 4 bills that we helped develop and advocate for successfully. The first one there, COVID liability protections, ensuring that any malpractice actions that are brought during the pandemic would take context into consideration, basically. Acknowledge that you all have been working under some very difficult positions, very difficult circumstances, I should say, as well as shifting state and federal government mandates. So that would need to be taken into context if there's going to be any malpractice actions that are brought against physicians. We helped develop legislation that requires payment for PPE under certain circumstances. So this would be specifically for clinic services that incur extra costs for PPE. We know that a lot of practices have during the pandemic. They are able to bill a new CPT code developed by the AMA and be reimbursed by commercial health carriers. Audio-only telemedicine is extending coverage and payment policies to telemedicine services that are delivered over the phone. And Health Equity CME, this was pursuant to support from our leadership who wanted to take action to help promote health equity, promote racial justice, a CME requirement that will be put in place for all healthcare professionals beginning in 2024, I believe it is, so a couple of years out. A lot more that happened in Olympia this year, and then more that's going to be coming down the pike, more work around balanced billing. Many of you know that issue well, and if you want to get involved in that, feel free to let me know. The federal government passed a balanced billing law that's now going to need to be reconciled with the state law. And the state's public option health plan continues to be an item of discussion, as does the Healthcare Cost Transparency Board, which was passed by the legislature last year, and is going to convene a group that is going to look at overall healthcare spending in Washington state and try to set benchmarks for controlling that moving forward, as some other states have done, most notably Massachusetts. So like I said, that is a very brief overview. There's a lot more that happened in Olympia. You got my contact information there. Folks can feel free to reach out. Always glad to talk about this stuff. Always glad to answer questions or be helpful as we can about anything that's happening in Olympia and beyond.
Sean, I have a question, which is that the state has a constitutional ban on income tax, right? Is the whole capital gains tax going to wind up in the Supreme Court, do you think?
Oh, yeah. Yep. And to go a step farther, Dr. Rice, you're right. The state does have a constitutional prohibition on income tax, generally speaking. I think the primary goal of the capital gains tax bill was to run a trial balloon to see what the Supreme Court will say more broadly about an income tax. You know, the last time the Supreme Court weighed in on that, it was quite a while ago. The composition of the court has changed considerably since then. I think Democrats feel that perhaps this court would be more inclined to an income tax, which would allow them to go back and pass a full-on income tax at some point in the future. Great question.
Sean, sorry, you go ahead, Alan.
I was going to say, Sean, I also have a question about long-term care taxes and a payroll deduction. What's the state of that?
Yeah, so the legislature last year passed a long-term care act, creates a long-term care insurance plan for residents of the state. You pay into it. It's a benefit like others that the state operates. First state in the nation to do so, by the way. There is an opt-out provision that says basically if you have long-term care insurance in place, you can opt out of the state program. There was legislation this year that was passed to kind of amend that. So now I believe it's July 25th is the date by which you would need to have personal long-term care insurance plan in place. Nope, sorry, they amended that. I'm just remembering it towards the end of the session. I'll follow up with more information on this. But by the fall, you'd have to have long-term care insurance in place so that you can opt out of the state's new program that's coming online. And like I said, I'll get you more information.
I think that's important because of being an employed physician. We're not going to have a choice if they just start deducting out of our payroll. So, can you hear me?
Yeah, I got a little bit of lag on that, but this would be an individual level choice. You would have the ability to attain the insurance plan and then opt out of the state's coverage.
So Sean, last question for me, and this is a great
Thanks.
update. It's so valuable to have you here. Before we go on with Alan, during the COVID crisis, telemedicine made a big breakthrough. I still see a very large demand from out-of-state patients. Has our state legislature discussed the nature of this going forth, or do we have to kind of negotiate that with every single state and eventually resort back to normal again and to get licensed in, let's say, Florida and New York?
This is so tough. It's a great question, Dr. Chapman. We've had this from a lot of folks. Washington State has taken action to say, if you are a patient in another state, Washington State law allows for that kind of cross-border treatment. However, we don't have the ability to say, to affect that of Colorado or Texas or what. Ultimately, this is a place where federal policy would be really helpful. But our state has been able to work with some other states to kind of create a reciprocity type of policy, but it's on a one-off basis. So yeah, there are still a lot of frustrating situations where you would have a patient who's gone back to California or Colorado, and you're effectively not able to treat them via telemedicine, or at a minimum, it's subject to state by state rules and restrictions. It's really difficult.
I'm glad that this has kind of become a discussion point, because obviously we'll probably need a federal solution, because I, for instance, can see a patient in New York State and Florida, but in Alaska, I have to get licensed in Alaska. So that's kind of just bizarre.
Exactly.
Thank you, Sean, and you're very articulate. We're in good hands with you, and we really appreciate your regular insights. And good news this time, I do agree.